What if I told you that one very common thing many seniors do after dinner is quietly putting strain on their heart, blood sugar, digestion, and sleep all at the same time, and that stopping it could improve how you feel by up to 30 to 40% within a few weeks? I know that sounds too simple. You're probably thinking, I've heard things like this before. And if you're anything like the patients I see every week, you've already tried supplements, special teas, strict diets, walking plans, and advice that promised a lot, but didn't really change how you feel day to day. My name is Dr. Elaine Foster, and I've been treating men and women in their 60s and 70s for over 22 years. And I want to be very honest with you. Most of my patients are doing many things right. They take their medications, they watch what they eat, they try to stay active, and yet they still struggle with fatigue, rising blood pressure, unstable blood sugar, reflux, poor sleep, or that heavy, uncomfortable feeling in the evening. I see the exhaustion in their faces, the frustration in their voices, the money spent on things that were supposed to help, the constant vigilance, checking numbers, reading labels, worrying late at night. And it breaks my heart when someone tells me, "Doctor, I feel like I'm doing everything I'm supposed to, and it's still not enough." That's why today's conversation matters. Before we go any further, I want to ask you something very simple. Please tell me in the comments where you're watching from, your country or city. I love seeing how far this community reaches, and it helps me understand who I'm speaking to. And let me be absolutely clear right now. This is not about replacing your medication. This is about safely supporting what your doctor has already prescribed and helping your body respond better to it. As we age past 60, several important things change inside the body, and most people are never fully taught how these changes affect the evening hours. First, insulin sensitivity naturally decreases. That means your body handles sugar less efficiently at night. Second, digestion slows, sometimes by as much as 30% compared to your 40s. Third, blood pressure regulation becomes more fragile, especially in the hours after eating. And fourth, the nervous system becomes more sensitive to stimulation, making it harder to truly wind down. But here's what most people, and yes, even many healthcare providers, completely miss. What you do in the first 90 minutes after dinner can quietly determine how your entire night unfolds. Even mild habits that seem harmless can create measurable negative effects over time. Slight reflux becomes chronic inflammation. Small blood sugar spikes turn into poor sleep. Mild evening dehydration thickens the blood overnight. These aren't dramatic symptoms, but they add up. Let me tell you about Margaret. Margaret is 68 years old. She said to me, "Dr. Foster, I don't understand what I'm doing wrong." She was taking her blood pressure medication faithfully. She ate a light dinner. She walked every afternoon. She tracked her numbers. Her husband was worried because she was exhausted by 8 p.m. and still waking up tired. So I asked her one simple question. "Walk me through what you do after dinner." She paused, and then she said, "Well, I sit down, I scroll on my tablet, sometimes I snack a little, I sip tea, and I don't really move much until bedtime." That was the moment. Her aha moment came when she realized it wasn't what she was eating, it was what she was doing after. We made a few very specific changes. Not extreme, not complicated. For example, instead of sitting immediately, she stood and walked gently for exactly 10 minutes within 15 minutes after dinner. She drank 250 milliliters of room temperature water, not cold, within 30 minutes, and she avoided screens for the first 45 minutes after eating. 2 weeks later, she called me. Her voice sounded different, lighter, calmer. After 1 month, her evening blood pressure readings were down by an average of 12 points systolic. Her sleep improved. Her reflux nearly disappeared. She laughed and said, "I honestly thought you were a little crazy, doctor, but it worked." Before I teach you the method, let me explain the 3 most common mistakes I see every single week. Mistake number 1, collapsing into the chair immediately after dinner. Think of your digestive system like a conveyor belt. When you stop moving completely, everything slows and pools where it shouldn't. Mistake number 2, sipping sugary or caffeinated drinks in the evening. It's like watering a plant already sitting in soggy soil. The roots can't breathe. Mistake number 3, mental overstimulation. Bright screens and stressful content keep your nervous system in alert mode, which directly interferes with digestion and blood sugar control. Now let me introduce you to what I call the CALM method. C stands for circulate. Within 15 minutes of finishing dinner, stand up and walk gently for 8 to 12 minutes. Not exercise, just movement. This helps glucose move into muscles instead of lingering in the blood. A stands for absorb. Drink 200 to 300 milliliters of room temperature water within 30 minutes after eating. This supports digestion without shocking the stomach. L stands for lower stimulation. Dim lights. No screens for at least 45 minutes. This allows insulin and melatonin to work properly. M stands for mindful timing. Avoid eating anything else for at least 2 hours before bed. I'll never forget Robert, age 72. His A1C was creeping up. He felt foggy every morning. He started with just the walking part. 3 weeks later, his fasting glucose dropped noticeably. 6 months later, his doctor adjusted his medication slightly. He told me, "I feel genuinely different. Here's how to implement this practically." How much? 8 to 12 minutes of walking. How often? Every evening. Keep a water bottle visible near the table. Set a gentle reminder. In week 1, you may notice digestion changes. Week 2, better sleep. Weeks 3 to 4, better numbers. Long-term, stability. Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Continue following your doctor's plan. If you have kidney disease, severe heart conditions, or balance issues, consult your physician first. Finally, let me tell you about Helen. She struggled for nearly 20 years. She felt hopeless. She cried in my office. She followed the method consistently. And one day she hugged me and said, "I wish someone had told me this years ago." I want to challenge you personally. Try this for 14 days. Walk, drink water, lower stimulation. Track how you feel. Comment your progress. If you made it to the end, type "calm evenings" in the comments. Small strategic changes done consistently create genuinely measurable results over time. This is Dr. Elaine Foster, and I'll see you in the next video.